Hi, Mallory.
How's it going?
Good. How are you doing?
Good. I'm really excited. We're doing our
Yeah.
podcast again today. So here we go.
Second episode.
Woo!
So today is August 31st is the day we're recording. Um, so
Yeah.
of 2023. So just to put a little bit of context into where we're at.
So Char had a great idea to talk about today, neurotoxin in areas other than the typical upper third of the face. So the most common areas originally were glabella, or the 11s, the forehead or frontalis muscles, and around the eyes, or the crow's feet.
Yeah. So there are neurotoxins. And when we say neurotoxin, we're talking about there's 5 of them in the US. Botox is the one that has the most name recognition in the US. It began to here medically in 1984 and cosmetically began to be investigated for its use in 2002. And so since 2002, from the cosmetic standpoint, we have had neurotoxins available in our market. And we currently have 5 in the US, and their names are Botox, Dysport, Jeuveau, Xeomin, and the newest one is Daxxify. They all do the same thing, and that thing they do is then they inhibit the ability of the nerve to communicate with the muscle and tell the muscle what it's supposed to do. But they each do it a little bit differently or have a little bit different effects. So they all work, but you may or somebody may prefer one product over the other for various reasons. One may feel differently to you as far as too heavy or not heavy enough, or there may be a little bit more spread. Sometimes somebody gets a headache from one over the other. There's a various reasons, but they all work. So they're all fun to try, but we all have different reasons or different things that we can do with each one of them. So that we talk about a few of those today.
And I will say, I think any of those little side effects, we can usually find a way around. So whether that's adjusting your dose or finding a different product that works better for you, the most important thing is to find your injector that you really trust, that works really well with you, and together you guys can figure out all of those little things.
That's a good point.
Yeah.
Excellent. So I have a list of things. Look at that. Boom. So I know. So we'll just kind of maybe go back and forth a little bit and talk about different ones. We're not going to be like dose specific because that can change for everybody. Or, we're not going to talk specifically where we would inject it, but we're going to talk about areas and why we might do a certain area for what purpose. So,
sounds
all right. You want to start?
Okay. So the first one on Char's list is to tighten the jawline. So the platysmal muscle goes along the side of the face, down the jawline, and down the neck. And when that's pulled tightly or hyperactive, think of it as like a sheet and it's like too flat. What we want it to do is follow the contour of the jawline. So injecting along the jawline can help.
And we can do, and there's various ways to do that. That's a really good explanation.
Oh, thank you. I didn't even plan that.
I know.
Straight out of my head.
This is my list, not hers. So the next one we have is the masseter muscle. And masseter, like mastication, so we're chewing. There's actually 2 muscles that are involved in chewing and mastication. One's the temporalis, which is this huge muscle up here. And if you tighten your jaw and you feel this, you feel that muscle contract. But the one that we usually treat, and we treat it for people who clench or grind their teeth at night, especially. This can cause ear pain. This can cause headaches. This can cause people to crack and break teeth.
Dental issues,
but we treat the masseter muscle here.
I wonder if you can see.
And that helps. Oh, yeah. And that helps keep that. It's a big, strong muscle, helps that relax. And people sleep better and they don't break teeth and their ear pain goes away and it's great.
Can you want to talk about aesthetic uses for that too?
Yeah. So what the other thing that it'll do is it softens the jawline. So sometimes if that muscle is really big, and I don't have a big one myself, that it can make, in some people's opinion, a more masculine looking or squared off jawline. Some people want that to soften and maybe be a little bit more feminine looking. I kind of like my square jaw because I feel that it gives my whole jawline balance. And so everybody is different. I just have one of those long, narrow faces that kind of needs that. And so I keep my masseters. but everybody, if you want, and sometimes it'll give a little heart-shaped face
Yes.
almost.
I
And
kind of like it for me because
it's popular in the Asian community.
it is. Yep.
Is to try to soften that jaw line.
It can be nice. Yeah. Okay, so the DAOs. So these are these little muscles down here, and when you frown, that's a muscle that's pulling down there. So if you feel like you have kind of a downturned look in the corners of your mouths, treating that can kind of pop up the corners a little bit, and it can help with texture down here, with expression, with a lot of kinds of.
Because as we aged, our depressor or pull down muscles become our dominant movement. So we want to kind of knock those back a little bit. So we have lifter and depressor muscles.
Yes.
So our lifter or our levator muscles kind of take over and do more work.
Right, right. So the DAO stands for depressor angularis or
Oris.
Thank you. I kept wanting to say oculus. So I'm like, nope, that's a what's the? Yep, there's another letter. It's go in a different direction. Thank you.
Oh,
see how we just play off each other so nicely.
Okay, the mentalis is the next. And if we have a very neutral mouth and we pop our bottom lip out, and pout, and we can get this little
like texture,
puckering, orange, peely skin, that kind of thing. And sometimes as we age, our chins naturally kind of crease here, and we get this we call it the mental crease here, and this caused by the mentalis muscle, and our chins draw up. So there's different reasons we might want to treat the mentalis muscle to smooth that skin, bring the chin down a little bit, and elongate the jawline. So that's another reason.
I really liked that one because just with putting on baby weight, I've got a little bit down here, and I'm waiting to do my lipo silhouette down here until after my weight has stabilized. I don't want to wonder how much of that was from weight loss, how much of that was from the medication. So, but until I do that, this having a little bit longevity of my chin kind of hides that, and it balances my face. So I like that one. So upper lip, we can do a couple of different things for that. Vertical lip lines. We don't smokers lines, that kind of thing.
Straw drinking lines.
Barcode lines, whatever they call it now. And so if you pucker and you get these little lines up here, it can help soften those. The other thing we can do there is the lip flip. So if that muscle that goes around the mouth like this, orbicularis, oris, if that one is pulling tightly, it kind of flips your lip under. So it looks like that. It's not a cute look. So when we relax that, it pops your lip up this way. So you see more of the pink, and that gives kind of a youthful appearance that a lot of people like.
And sometimes the lip lines are just from volume loss. I don't smoke, don't drink excessively from a straw, but I just have volume loss in that upper lip. And so
we pretty much all get those.
I mean, you'll get it. Your vermilion border will soften. I mean, it just happens.
It happens.
So it's a really nice thing to do. Gummy smile. So some people have a smile and they just naturally lift up their upper lip, and it shows their gum above their upper teeth, and it's something that some people are really bothered by and don't like that. And we can place Botox in certain little areas here to relax that muscle when we're smiling, so it doesn't pop up as much. So
platysma. So we went over platysmal muscle a little bit. The other thing that you can do, we talked about it for the jawline, but you can also, it affects the neck. So if you get platysmal bands where you're like, and they're like pulling really tight here.
Are you doing
it?
Yeah. I don't know. Anyway, I have them. I'm older. I'm a lot older than Mallory. Oh my God.
I don't know. Anyway, the going into the bands themselves, that can help relax those. So if you're bothered by that, and if we just see any irregularities in the platysmal muscle, I was starting to get away from myself there, that can help smooth that muscle, relax it, give you a nice, smooth, long neck appearance.
So it's one of my favorite things to do. I love having that because as we get older, those it's just like any kind of ligament, it shortens up. So it pulls down, and just relaxing it a little bit.
Makes them less noticeable.
Makes me feel better. The next one we have is thin the nose.
Oh yeah.
Sometimes people feel, and I think, and everything relaxes as we get older too, or some people are just built with a little bit broader nose across here, and Botox placed along in certain areas along the muscles in the nose can kind of cause that muscle to shrink back a little bit and recede, and then we get the appearance of a thinner nose.
Oh, you know what you didn't put on your list? I don't see there. Oh, the bunny lines.
Oh, yeah, right.
So related to the nose. If you scrunch up your nose, you get those little lines right in here. Some people will notice those more if you treat other areas of the upper face, and then you smile, and those ones kind of get a little overactive. We can relax those too.
Yep.
Pore size. So if relaxing the muscles right around those smooths the skin and will make the pores less noticeable. You know, you're kind of born with the pores that you're born with, but if they gather a lot of debris, they'll look darker if there's a lot in there. And if they're I don't know.
Well, and pores are kind of increasing pore size for some people, and it tends to be people with like thicker skin. It is kind of a symptom of laxity.
Yeah.
We start to see an increasing pore size with that. It's not a long-lasting thing. So a lot of people will do that if they're going to have photos taken, or maybe an event or something. They want their makeup to lie smoother or something like that. So it's not a long-lasting thing, but it is something that that can be affected in a positive way, smooth things out from neurotoxin.
Since you brought up longevity, we should point out that most of these areas we only expect to last about 6 to 8 weeks. So whereas for the more common neurotoxins, Daxxify is not quite the same in that sense. But in the upper areas of the face, we usually expect most of those to last about 3 to 4 months, but the lower face and neck about 6 to 8 weeks for typically.
Often platysma we can get more.
A little bit longer.
Yeah, a little bit longer out of platysma. So the other thing with the neck is there are these horizontal lines that run along our neck, because our neck sits in this lifelong vertical axis, and so it's really affected and subject to gravity.
And they call them the necklace lines or tech neck, because we all look down at our phones a lot now.
I don't like them being called necklace lines. Necklaces are supposed to be pretty and something you want to show off. I don't want to show those off. Oh, and the other thing is lines that we get on our chest.
Yeah.
The décolletage lines. It can really help smooth those out.
Agreed.
So.
And we were going to talk about hyperhidrosis. Yeah. So there's some really fun things you can do if you have excessive sweating. Underarms, palms, soles of feet.
Upper lip.
Those are the most common areas. I've had more than one person tell me like, oh my God, not to be dramatic, but you changed my life.
Changed my life. Yeah, without a doubt.
It's kind of a crazy thing because if you go to shake somebody's hand and your palm is just like dripping, it's, can affect the interaction that you're having because of how you feel about that.
Yeah, absolutely. Yeah. And sometimes depending on the severity of the hyperhidrosis or the sweating, it won't completely eliminate it, but really decrease it.
Right.
Manageably. But for a lot of people, it really stops it for months. Sometimes,
and that can vary patient to patient too, the course that we go. Some people will do a few treatments, a few months apart maybe, and then pretty soon you're going longer and longer, and at some point you just may not need to do that anymore if we get to the point where it's well managed. Which cool. Is awesome.
Thanks for watching.
Wait, I was going to ask you, well, I was going to throw a curveball at you here. What is your favorite of those? You kind of gave it away a little bit.
Oh.
I was going to interrupt you and say, don't go any further. I want to hear more about it later. So Char's is the neck, right? Okay.
Of these,
yeah. Okay.
Yeah. My neck's just a thing for me.
I think mine is mentalis. I just really like. Funny? So that muscle is funny in that it has lots of fibers that come through directly to the skin. Most muscles don't do that. They're kind of self-contained and attached.
And that's why we see the puckering of that, because of the attachment of that muscle to the skin. Yeah.
And if you think about all little things like this attaching and then like shrinking back in. Yeah. That's like that little texture, and that can really smooth that too. So I like that one a lot.
But I mean, my favorite is the neck, but my DAOs, my upper lip,
the nice thing
my jawline.
just a couple of things. But you know, I was talking to somebody earlier and it was like they just are like frosting. It's just like glazing, just subtle little things that together can add up.
Yeah.
Or if there's one thing that really bugs you, it's like, oh, that's a nice little fix there.
Right.
So
That's
yeah.
right.
Mhm.
Neurotoxins are so great that way. It's not, it doesn't have, it can be completely isolated to one
Mhm.
problem, issue,
Yeah.
something that you don't like,
Mhm.
that we can help to soften or improve,
Yeah.
or we can treat multiple areas.
Yeah.
So that's what's pretty cool.
Very cool.
Yep. All right.
And we're back. I need a moment to apply my obsession of the week. So here it is.
Can you see it? Yeah, tell them about that.
So these
You wear them well.
I do. Thank you so much. I forgot the little container here. So these are the Image MD Restoring Eye Masks. They are amazing.
Kind of a dream, right?
A dream come true. They are cooling. They like immediately constrict. So if you have under eye puffiness, it is just nice, cooling.
First thing in the mornings, last thing at night. You know,
both. Yeah.
Yeah.
They're a good one. I'm
yeah,
obsessed.
and really hydrating,
Very.
right? I
Mhm.
mean, they're going to add a lot of moisture. I mean, immediately afterwards, even just like those fine lines underneath your eyes
Yes.
look so much
Yes.
better because they're plumped up.
Definitely.
Yeah, and just
Mhm.
the way they feel. And somebody, Jenna, I think, said that she keeps hers in the refrigerator.
Oh man, I did that, and it was like, oh, but even straight off the shelf, they feel cool. They feel like they've come out of the fridge.
Right.
But doing that extra step, it's like,
Yeah.
little spa, little me time. Yeah.
So mine is BioCool.
Mm.
And many of you I know have heard me talk about this before, and it's called Professional Burn Relief. It contains zinc, vitamin C, aloe vera, and lidocaine.
Mhm.
And it's sometimes they call it the vacation saver or whatever. It's to be used after sunburn. It can be used as our laser treatments. We like to use it after BBL.
Yes.
But the thing that I love about it right now at this time of the year is it is wonderful for post mosquito bite or bee sting. This is, the wasps are out, the bees are out right now. Plus mosquitoes are still out there.
Yep.
I'm not kidding you. You put it on one time and it not only stops the itch, but it helps it to heal because of the zinc and the aloe vera.
Yep.
And vitamin C also. So this is $12 a bottle.
Get yourself some.
Yeah. You use such a small amount. I also keep it in my refrigerator.
I was just going to say, I stole that tip that you told me, and now everybody knows where it is.
Everybody in the family knows where it is, right?
And it's nice and cool, and
it's,
like,
it's amazing.
Yeah.
Yeah.
That's funny that we both picked cooling
Yeah,
things.
I know.
In August.
It's funny.
Oh, and then our personal obsessions. Okay, so mine was from this morning. I went out and I was letting the ducks out. Funny how I'll always manage to bring up my ducks. I was letting the ducks out and feeding them, and Wyatt was with me, my son, and I saw these little caterpillar cocoons on some of my plants, and I was like, Wyatt, look at these. And he's started preschool, so he's learning about these things, and The Very Hungry Caterpillar is one of his favorite books. So I'm like, look, it's a cocoon. And he starts telling the whole story. He's like reciting the book back to me. It was so cute.
Wow.
So then we go inside and I'm like, tell Dad what you saw outside. He goes, Dad, I saw a raccoon. Like, cocoon. So that was my
funny.
What yours?
I don't know, actually. I'm kind of stumped on that one.
Oh, well, you knew we were doing this today, Char. I don't know what to tell you.
No excuses.
No mercy. Quick, think of one.
I do want to thank people. We've been asking people for some some reviews and that kind of thing. Unfortunately, we have to.
Yeah.
It's just part of the game that has to be played. So we really appreciate you taking the time to do that. And that, I guess that's my thing for this. It's thank you.
Nice.
Thank you very, very much for doing that for us.
We appreciate them.
Please keep doing it.
Please.
All right. Again, thanks for watching.
Yeah.
We would love it if you haven't already. Please subscribe and ring the bell for notifications. Please like this video, and it really helps our algorithm if you make a comment down below.
Please.
Yeah, love it.
Thanks.
So thank you.
Bye-bye.